Today we will talk about ultrasonography in pregnancy. When should we do it and what information we'll get by doing this ultrasonography. So in the first trimester, that is the first 3 months of your pregnancy, we advise ultrasonography first at around 6 to 8 weeks. So what information we'll get by doing this ultrasonography? So we'll come to know about the location of the pregnancy, whether it is inside the uterus or outside, that is called as ectopic pregnancy. Second thing, we come to know about the exact date of delivery by measuring the length of the baby. Third, we come to know about the how many babies are developing, that is if you are having a single baby or you are having the twins or triplets. Fourth is to check the baby heartbeat. Next sonography we will advise at around 11 to 14 weeks of pregnancy, which is called as the anti-scan. So by doing this scan we come to know certain chromosomal disorder in the baby such as Down syndrome. So this sonography is very important to do during 11 to 14 weeks of your pregnancy. Then come the second trimester. So in second trimester we will use to do sonography at around 18 to 20 weeks, which is called as the Anomaly scan. This scan is again very important. By doing this scan we come to know any structural defect in the baby. So the patient should not miss these scans. If you are having any history of preterm birth or any high risk factor which is suggestive of preterm delivery, then we come to know about the cervical length by doing sonography in the second trimester. Then in third trimester, that is the last 3 months of your pregnancy, we will do the growth scan to see the growth of the baby, amount of water, that is the amniotic fluid index, and the placenta. In the third trimester, we sometimes advise the color Doppler study of the pregnancy. This is indicated in patients who are having high risk factors such as increased blood pressure or the diabetes. Apart from this sonography, sometimes extra sonography are needed if patient is having certain complications like reduced fetal movements or bleeding during pregnancy or the twins or triplet. In case of multiple pregnancy like twins or triplets, patient need more sonography to see the growth of the baby or if there is any complication developing in the twins or triplets. These sonographies are completely safe during pregnancy and there is no harmful effect by doing the sonography on the developing baby. Also, it is to be noted that in 2 to 3% of cases, not all the anomalies are detected by doing sonography, which can only be seen after the delivery of the baby.